Hello and welcome back. Today let's talk about stigma surrounding autism in the Middle East. One of the studies was conducted in Saudi Arabia and the other one was in Iran. Culturally, I think you would agree with me that all these countries in the Middle East are quite similar. So I think these studies do reflect what happens in societies. First of all, we should know what autism is and the myths surrounding it. We would talk about the particular stigmas that people in the Middle East face. Autism is a particular pattern of disability that is both sufficiently severe. This includes real difficulty with reciprocal social relationships, difficulty with the communication, poor social imagination. And one criteria that is very important is that these characteristics must be present from early childhood, which distinguishes it from other disorders like schizophrenia. In the past, there was another category under Asperger's syndrome, but now they also categorize under this umbrella term that we call autistic spectrum condition. In this video, because we are referring to the societies in the Middle East, there are some misconceptions that are present in the society that hinder the progress to empower people with autism. First of all, people believe that vaccination causes autism. However, this has scientifically no basis. Each family has a unique experience within autism diagnosis, and for some it corresponds with the timing of their child's vaccination. So sometimes it might appear that vaccination causes autism, but it's not true. Secondly, autism is considered a disease, so there are people and professionals who try to cure it, which is again not acceptable. There is a widespread belief that bad parenting can cause autism. Especially mothers have been blamed for not taking care of their babies. This belief has also been debunked. So there is no correlation between autism and a lack of affection or care from a parent. This can be devastating for a parent or for parents for that matter. Fourth, it is considered that only children, particularly boys, have autism. It is essential to note here that after numerous studies, it has been validated that autism is not gender or age specific. Anybody can have it. Let's see some facts about autism. First of all, it runs in families, so it's genetic. We still need more research into this. It has been shown that different mechanisms and different geographical regions in different families produce the same outcomes that we call autism. Second, it is also true that in 10% cases, autism is secondary to other underlying medical conditions. For example, poorly controlled epilepsy makes autism worse. Occasionally, epilepsy on its own might mimic autism. Genetic and non-genetic aspects affect early brain development that affect how brain nerve cells or neurons communicate with each other. Therefore, different brain biology is also a reason. There are other biological issues such as advanced parent age, pregnancy and birth complications, and pregnancies spaced less than 1 year apart. All these factors increase the risk of getting autism. Now, if you look at autism in the Middle East, then we would know that how it impacts the people and society. It has been seen that parents face challenges and difficulties caring for their children with autism. This in turn creates the feeling of self and enacted stigmatization. Mostly mothers are the ones who suffer the most. Both parents experience mental problems and stigmatization to a certain extent. Mothers have more mental health issues because they are the primary caretakers of their autistic children. As we just mentioned, enacted stigma, society looks down upon parents of autistic children, which puts more pressure on parents. It has been reported that autistic kids are judged by the people and the parents are given unwanted advice. The most devastating factor is the fact that some parents are in denial and they do not accept that their kids could have autism. So what adds to this is the way some unethical professionals use autism as a way to make money by giving false hopes to parents of autistic children. To support parents and conservative cultures and in the Middle East, the first thing is to have early intervention. This can help experts teach kids coping strategies from a young age. Second, parents or society should embrace differences of individuals so they do not feel isolated and left out. This will also help autistic people get opportunities like any other individuals. In case of autism, it's about an individual who is one of us. So people should be educated about autism so that there is acceptance in the society. Fourth, parents, especially mothers, undergo a lot of mental problems. They should be provided psychological support and social interventions by government and private organizations. To sum up, we still need to know a lot about autism. Enough research should be done to enhance our knowledge and get more insight into it. Before I sign off for today, here is a summary that you could read. See you next time with another topic. Bye bye.